Hi guys, I said I'd post a video on how to properly engage your core, as well as I'm going to talk a little bit about diaphragmatic breathing and core bracing and how this can help if you have a low back injury, disc injury, things like that. A lot of things that people are dealing with in this group. So first, don't mind the nursery. I'm actually in the nursery for a reason, because the developmental process of breathing and bracing actually occurs when you're a baby and developing at that age. So if you look at a baby, a lot of the things that babies do are things that we should be doing, but over time, oftentimes we lose that just through different things that we do in our everyday lives, and we start to compensate and different things like that. So first off, think about if you just watch a baby in general breathe. They got a really big belly and their bellies move in and out. We call that diaphragmatic breathing. So we want the diaphragm to work properly, and I'm going to kind of kneel. So your diaphragm is right here. When you inhale, that diaphragm contracts and it actually drops down like this. So if you use your diaphragm to breathe and it drops down, this is going to expand through the belly. A lot of people are chest breathers and you see their chest rise and fall. It's okay to utilize your chest when you're exercising extensively, but just at rest, you should be using your diaphragm to breathe, and that's what that muscle's there for. I talked about in one of the comments in one of the posts that your core consists of a lot of different muscles, and one of those muscles is the diaphragm. So think about your core in general as a box, and a box has 6 sides. So the box is going to be the diaphragm up top, so that's the top of the box. Your pelvic floor on the bottom, that's the bottom of the box. A lot of people forget about those 2 aspects of the box in the core when we're talking about the core. So those have to be engaged as well. We also have the front of the abs, so the rectus abdominis in the front. We have the obliques and the transverse abdominis on the side. And then in the back, you have your erectors, which a lot of times people have a lot of spasms and pain in the muscles in their back. So that is considered part of your core. I also want you to think about from the rib cage down to your pelvis, the only bony structure you have is your spine. So if you don't support with the other muscles around that area in the core, then all the stress goes straight to your spine, and then you'll end up hurting it down the road. So you just keep repetitively engaging or putting stress on the spine and not engaging the core, then that spine is going to degenerate over time, and you're going to gradually increase your chance of injuries. Above the diaphragm, you have the rib cage all the way up into the shoulder. So you have a nice bony structure up here that doesn't need as much muscular support because the bones are there. Whereas down here, like I said, between the bottom of the rib cage to the pelvis, this is all muscle except for the spine. That's the bony support. So you need all that muscle support to not injure yourself. So think about the core, like I was saying, as the box, the diaphragm, the pelvic floor, the abs in the front, the abs on the side, and then the erector muscles in the back. And there's multiple layers of those erector muscles, but we won't get into that. So to engage all those muscles together to support, we want to also think about that as kind of like a balloon. So think about the core, that sphere or that box that I was talking about. Think about it when you're engaging it, what it's actually going to do is slightly expand in all directions. So it's going to create a wall. Now, some people are taught to suck in, so you might have heard belly button to spine in some of your therapies. That's an old concept that we really want to try to get away with. So think about the analogy that I like to use is a soda can or a can of Coke. If you have a can and think about the outside of the can as your core, if there's no dents in the can and you start stacking bricks on top of that can, it's not going to collapse. Once you put a dent in that can, it's only going to be able to support a couple bricks before it starts to collapse one way or the other. So if you think about that can being your core and you suck in, if you suck in towards your spine, what that's doing is putting a dent in the front of that can. So it's actually decreasing the support that you have for your low back and your spine. So I want you to think about more of the expansion, slight expansion into those areas to help support. And I'm going to demonstrate as well how I typically teach people to start to engage their core as well as diaphragmatically breathe. So I'm going to move this down so we can kind of see what a diaphragmatic breathing looks like on the floor. So if we come down here, and you can also just, like I said, think about a baby and how they breathe. Their bellies go up and down, and you see that expansion and contraction. So what you want to do is you want to put a hand on your chest and a hand on your belly. You want to limit as much motion in the chest, because if we were to do breathing up and down, I'm going to kind of demonstrate what we don't want to do, and this is going to be the chest breathing. We have the chest rise and fall, which that means we're using a lot of the accessory muscles in the neck and in the chest to help get that rib cage to expand so air can come into the lungs. What we want to do is we want that diaphragm to contract, so that when it contracts, it moves down to allow more space in the lungs and so that air will automatically come in. So put the hand on the chest, put the hand on the belly, and really whatever comfortable, whether you have your knees bent up or if you have your legs straight, you can kind of see what's more comfortable for you. But you also want to make sure that you have a neutral spine as well as a neutral pelvis. So what I'm going to demonstrate is a rib flare, so you can kind of see my ribs flaring up. And then oftentimes people will have a pelvic tilt. So if they're tilted one way, anterior pelvic tilt, or posterior pelvic tilt, that's going to change the amount of pressure that we can create within the core. Actually, let me bring this back up to talk about one more thing before we get into the breathing. So with the core in general, I also want you to think about the diaphragm and the pelvic floor that we talked about. If we have the rib cage flare, that's what that's going to do. So here's your rib cage, here's your pelvis. If we have the rib cage flare, it's going to come up like this. If we have the pelvic floor anterior pelvic tilt or posterior pelvic tilt, that's going to create abnormal stress response within the core too. So think about the pop can. So your diaphragm up top is going to be the top of the can. Your pelvic floor on the bottom is going to be the bottom of the can. So if we have that can going one way or the other on the top or the bottom, then it's also not going to allow the proper support. So we want to make sure we're not rib flaring, and we're also make sure that we have a neutral pelvis, so we're not anterior pelvic tilted or posterior pelvic tilted while we're doing this exercise and breathing. So back down here. When we're down here, so we're going to set that spine neutral. So we got a nice flat spine onto the ground. Same thing with the pelvis, making sure that we're not anterior pelvic tilted or posterior pelvic tilted. So a nice neutral spine there. Hand on the chest, hand on the belly. When we breathe in, we want to think about a tube from our mouth all the way down through the chest into the belly. So when we're breathing in, the belly should rise. So it looks something like this. Breathing in general can be very relaxing. It can help just in general with pain. So I encourage you to practice the diaphragmatic breathing, breathing in and out, nice, slow and controlled movements. And you should gradually work this to being just natural and automatic in your life. So you shouldn't have to try too hard to keep this something that happens automatically. So if you're a chest breather, you want to get away from that. You want to try to be more of a diaphragmatic breather so you can get that diaphragm acting properly so it can help support and be a part of that core. Because if the diaphragm's not activated while you're breathing, then that top part of the can is not there, and you can't support properly, and pressures are going to be put and stress is going to be put on different areas of the spine. So next, let's talk a little bit about bracing. So a little bit different of a concept. What I like to tell people when I'm teaching them this is to think about if someone were to punch you in the gut really hard, what would you have to do in order for that not to hurt you? You have to brace, correct? So bracing is engaging the core in a way that is protecting the body. So when you're lifting, when you're bending, when you're moving, the body should automatically create that natural brace in the core to help protect the spine. If you're not creating that brace, or if that brace breaks when you're moving, then the load is going to be transferred somewhere else. And oftentimes it's the spine, because we talked about how the bony structure in the spine is there and everything else is soft tissue. And if you're not supporting through the soft tissue, it's going to go straight to the spine. So with bracing, think about bracing if someone was to punch you. Now, I don't want you to think about squeezing as hard as you can, because that's like intra-abdominal pressure. If you create too much of that at one time, that can irritate a disc bulge as well. So sometimes if people have trouble when they're going to the bathroom trying to bear down, That's actually a test that we will do for people that come in the office with a disc injury to see if too much intra-abdominal pressure reproduces some of their symptoms. So too much intra-abdominal pressure can actually cause the disc to bulge a little bit more, and that can reproduce some of the symptoms. So what I'm trying to say is we don't want to do too much pressure at once. So it's just a simple engagement, and a lot of people will over-engage and create too much pressure. We just want that simple engagement. I'm going to show you simply how we do that. So you can sit however you want. You can stand when you're doing it. Find a position that's most comfortable for you to do this. It really doesn't matter at the time what the position is. Oftentimes I'll have people lying on their back to do this, similar to what they're doing when they're breathing. But if sitting or standing is more comfortable for you, then do it that way. So I'm going to kind of show you just so you can see what it looks like in my belly. But I tell people to put their fingers here on the front of the hips so you can feel the front of the hips. You want your thumbs onto the back / sides so you can feel engagement there. We want to feel an expansion into the front, sides, and back. So with this, if I'm going to engage, you can kind of see I have a little bit of pressure outwards, and my belly expands in all directions. You can see my fingers moving. I can feel pressure. So here are my fingers. When I engage, my fingers go out like this because the pressure is expanding outward in all directions. So it's creating that brace 360 degrees around this way. And also when you're creating that brace, I get that diaphragm engaged and that pelvic floor engaged at the same time. When I automatically do that, those guys will engage at the same time. And you can tell when I'm engaging, I can breathe, I can do movements, I can flex and extend, I can rotate. That engagement is still there. I'm still applying pressure. It's nice and solid all the way through, and it's stable. You want that stability when you're moving. If I'm not engaging, so oftentimes when we test people through movement. So I have someone do a squat or lunge or something like that, do a sit to stand. I check and see what their core is doing when they're doing that. So if I have someone going into a squat or something like that, and then they start to flex forward, they're around their back, they're losing that engagement up here. If they're engaged here, we're gonna have a nice structure and nice support through the spine. It's not gonna collapse and push and force pressure down into the back and in a sense cause more damage to the discs. So that's simply how I will start people out with explaining how to support the core, how to engage the core, how to breathe properly. That's really the foundation. If you haven't built that foundation, or if you've lost the ability to do that, then oftentimes that's one of the underlying reasons why people start to develop disc injuries and low back injuries. Same thing goes for other areas of the body, but we're talking mostly about low back and disc here. But the same concepts will apply to other injuries in other areas of the body, whether it's neck, shoulder, knees, hips. We apply those same concepts. So if you look at it from a developmental standpoint, when I talked about, being an infant and a baby, you develop the ability to do those things at a young age. And then if you lose that, or if you start to compensate in one way or another, and your body doesn't move or engage the way it should, then you will start to compensate in other ways, and that's when the body starts to break down and injuries start to occur. So I hope this helps some people. Feel free to ask questions, and I'm happy to answer anything that I can. Again, none of the advice or things that I'm posting are to be intended as medical advice or diagnosing or treating. It's just to engage you and to make you think a little bit differently. Hopefully it triggers something so that you can look into another direction and start healing in a way that maybe you haven't been healing in the past.